Right. Well, thank you everyone for joining us. We are really excited to have this last call and see you guys in one week in Baltimore and in DC. So I am recording the this call for those of us who can join today, or if you guys want to go back and see if you missed anything. Next slide. Right, again, this is our team. We have Lauren, Ranjana, myself, Rebecca, Erica, and Ned, and Joanne, who you will get to meet next week. So we are all really, really excited to meet you. I know some of you have already met some of us, but those of us who haven't, we are really excited to see you in person. Next slide. Great, and then this is our agenda for today. We have a quick thank you to our sponsors. We have some details on the hotel check-in and Tuesday dinner, some more details on the training on Wednesday, and then of course our advocacy day on Thursday, some weather and a refresher on our ask and our meetings, the photos, just some more reminders and reimbursements and upcoming dates. And then we will end with a Q&A at the end. Next slide. All right, so we just want to thank our sponsors for this 2023 Respiratory Advocacy Day. We have 3 premier sponsors and 4 champion sponsors, which are on the screen here. Next slide. All right, so for hotel check-in, we just ask that you bring a driver's license and a credit card. The credit card will be used for any incidental charges to your room, but you should not be getting any charge beyond that if you didn't have anything happen to your room when you check out. And we have taken care of all the hotel reservations, so you don't have to worry about any of that. You just show up with your driver's license and your credit card, and you will be given your room. Next slide. All right, and then when you arrive on Tuesday, we will be staying in the Westin BW Hotel. So when you arrive, if you arrive at BW Airport or the BWI Amtrak station, there are shuttles that are provided from the hotel. So you can call the number that is on the screen here. You will just tell them where you are and they will come get you with the shuttle. But of course, you can also take a taxi or an Uber if you prefer those options. We just ask that you keep the receipt for reimbursement later on. Next slide. And then on Tuesday, after you arrive for dinner at 6 p.m. in the same hotel that you're staying at, we will have a patient advisory group dinner. So of course, this is if your flight arrives on time. Next slide. All right, so then training on Wednesday will be all day. We will begin at 8 a.m. With breakfast, and then at 9:30 through 11:45, we have training. We have a lunch break from noon to 12:55, and then we resume training at 1 p.m. to 3 p.m. We do have a break at 3 p.m. through 3:25, and then we have our roundtable discussion from 3:30 to 5 p.m. And then at 5 p.m. we have a reception, and we are ending the day at 6:30 with dinner. We are in the same room all throughout the day, so you don't have to worry about moving or finding another room. We are going to be in the same one. So that's a plus. Next slide. All right, and then on Thursday is the big day, our Respiratory Advocacy Day. We will begin nice and early at 7 a.m. with breakfast at the hotel, and then the buses are going to take us to Capitol Hill at 8 a.m. At 9 a.m., we will have a group photo in front of the Senate fountain. And then our meetings are going to be from 9:30 a.m. to 5 p.m. Like we said last week, this doesn't mean that you're going to have a meeting every single hour during that time. It just means that your meetings are going to take place somewhere in between that time frame. Some of you might have some time in between, and we will talk about what you can do in a little bit during that time. And then at 5:30, there will be buses going back to Baltimore, and you will end the day with dinner at 6:30 with ACRC. Next slide. All right, and this is where we will be taking our photo in front of the Senate fountain. So just to get an idea of where it's going to be. Next slide. All right, and now I will hand it over to Ranjana, I believe, to take over.
Yes. Hi. Okay, so you're going to be on the Hill for the whole day. And like Rebecca mentioned, you're not going to be in meetings all day. You're going to have anywhere between 4 to 6 meetings. So if you have a really big chunk of time between meetings, there are things you can do. If you have 2+ hours, you are more than welcome to try and go and visit a DC site like the Library of Congress or the Botanical Gardens. These are things that are within the Capitol centric area. I Please do not try to go to a Smithsonian museum. That's going to require a cab, and it's going to, you're going to go a lot further, and then you might not come back in time, and there's security that you have to go through to get back into the building. So just there are a few places that might be that are closer that you are welcome to go to if, once again, you have like 2.5 hours plus time. There are other things you can absolutely do. You can send your follow-up emails to staffers that you met with, that you can work on. You can log your feedback in the Soapbox mobile tool. So next week, Soapbox Consulting, who is scheduling all of our meetings, they're going to run through what this mobile tool is and kind of where we want you to provide feedback of how the staffer responded to the 3 asks, and if you got any other tidbits. That's really important for myself and Erica especially. So we would really appreciate it if you log that in. Other things are, taking and uploading photos that we'll talk about a little bit later, but we have a Google Photos album that y'all can add your photos to. The other thing is, if your meetings are over by 3:30 p.m., and you want a place to rest that perhaps isn't the rambunctious Capitol or the Senate side or the House side, you can spend time at the Health and Medicine Council. These are partners of ours. They're our contract lobbyists, and they have graciously offered their conference room for the afternoon. So that's a nice place to go and rest. And it's a little quieter. And we have a one-pager that's going to be in all of your participant folders with their address and who you might need to ask for. That's also where we're getting dropped off in the morning by their office. So you're kind of going to get an idea in the morning before we go to our Senate photo, or our photo in front of the Senate fountain, that like, oh, this is where the office is. We're also, that one pager is going to have more ideas about things you can do between meetings. Next slide. Okay, so COVID is not over, and we are entering into just respiratory virus season, RSV, influenza, COVID, etc. So if you are experiencing any sort of sick symptoms right before Respiratory Advocacy Day, we definitely encourage you to take a rapid test, COVID rapid test, and let Annette and please let Annette know as soon as you find out if it's a positive test, that you have a positive test, and you will unfortunately not be able to attend Respiratory Advocacy Day. And I hope, given that this is a respiratory advocacy event, everybody is going to be very understanding of why we're trying to be very careful. And so if you are also experiencing COVID symptoms while in Baltimore or in DC, please inform Erica and Annette. We will get you a rapid test, and we will make sure that you are able to get tested and the appropriate care that you may need in case it does come back positive. Next slide. So the weather. It is going to be warm next week. And so I would definitely be mindful of that. On the day that we have training, I think usually we ask folks to dress a little business casual, nothing crazy, but it is a hotel, so you might still want to bring a sweater. I'm usually chilly in hotel conference rooms, so just to be mindful of that. And on the day of the more updated, I just checked the weather like 5 minutes ago, and it looks like the high is 77 on our advocacy day, which is going to be really nice, but it is sunny. So just be prepared. You don't need to you don't need to bring a coat probably to the Hill or anything like that. So that is just to be mindful there. We do ask that everybody dress business professional for the Hill. Just business on the top, pants, skirt, dress. You can wear tennis shoes or any comfortable shoes, of course, because the granite floors can hurt if you're wearing heels. I wear heels, but that's because I don't listen to my own advice. So there's that. Next slide. Now we're just going to quickly go over our asks, and I'm happy to provide just some brief updates we've gotten since the last time we chatted. Next slide. So of course, one of our first asks is please support forthcoming reform legislation to ensure Medicare beneficiaries access to supplemental oxygen. So as a heads up, Senator Cassidy has agreed to be a sponsor of our bill in the Senate. Woohoo! This is very exciting news because this legislation has never been introduced before, so it's really hard to get a sponsor. So that is exciting. We are still working to identify a Dem Senate sponsor, but this is something that you can share with staff when they ask, like, well, okay, forthcoming, who's sponsoring it? You can say Senator Cassidy has agreed. And when you talk to House staff members, you can definitely let them know that we are working on identifying sponsors in the House, but that, look at this, we've made progress in the Senate. And so we're actively working in the House to get this introduced. So that's really exciting news. Next slide. Our next ask is please co-sponsor the Family Asthma Act. So right now, the Family Asthma Act on the House side is with Legislative Council, and it is in the mercy of LegCo, that's for short. But we are hoping that it will be in Representative Dingell's staff's inbox later this week, and that it will be introduced hopefully early next week. We're really hoping, fingers crossed. And so we will let you know the day before what the status of that bill is. It is created, it's been updated. We're just waiting on LegCo to give us the thumbs up so it can be introduced. You can let House staff know that the bill is bipartisan. We're expecting Representatives Dingell and Valadeo, who are co-chairs of the Asthma Caucus, to help introduce this bill. We also have Representatives Blunt Rochester and Fitzpatrick, who are expected to co-sponsor as well. So these are 2 Democratic House members and 2 Republican House members. When speaking with the Senate, please share that this is where we're at with the House and that we are actively working with Senator Gillibrand to get this reintroduced. Her office has historically introduced this on the Senate side. Hasn't happened for the last Congress or so, but we're in conversations with them. They are wanting to do it. It's just going to take a little bit of time, but that's where we're at with the bills. And if for some reason the bill is not introduced before Respiratory Advocacy Day, we will let you know if you need to kind of retailor the ask, kind of to make it similar to the oxygen legislation. Next slide, please. Okay, our final ask is to please support robust, predictable, and sustained investments in CDC and NIH to improve our nation's lung health. We are in a precarious political situation, as I'm sure some of you or all of you are aware. Your meetings are going to be taking place 9 days before government funding is set to run out. Government funding is set to run out at the end of September, and it is unclear as to whether or not Congress is going to be really able to get their act together, especially on the House side, to pass a temporary stopgap, continuing resolution, and that is what would keep the government temporarily funded while they kind of figure out all the different levels of funding they would want for the labor HHS bill or for defense and et cetera. So with this, we are not asking, we're not including specific numbers for NIH and CDC on purpose. If someone asks you for specific numbers, you can let them know that a lung association staff person will get back to them with those specifics. And then we would really appreciate it if you include that in your feedback form so that Erica or I can reach out to the office to have that more nuanced discussion with them. You're here to ask for robust and sustained funding for NIH and CDC because biomedical research and public health prevention are key to reducing the burden of COPD and asthma, and that you're concerned with people with lung disease will be severely impacted by a government shutdown. Clinical trials will be put on pause, surveillance may be delayed. So that's the level, I think, given how partisan everything is right now, that we want y'all to keep it at. And then some of the more nuanced stuff, Erica and I can kind of take a little bit offline or just separately. Next slide. So your meetings, let's go on to the next slide. So this is a map, and we will be providing you with this. This is going to be in your participant packet, but this is how Capitol Hill is set up. You have the Senate buildings on the north, which is the top of the map. So you have Russell, Dirksen, and Hart. And then you have the House buildings, which are south. At the bottom of the map, you have Rayburn, Longworth, and Cannon. So you are going to have meetings in these in some of these 6 buildings. You're probably not going to have them in all 6, which is great because it's a lot of walking, but they are going to be somewhere there. And usually the way Soapbox creates your schedule, they try to be mindful of making all the Senate meetings kind of in the morning and then transitioning to the House perhaps in the afternoon. That way you don't have to go back and forth, back and forth. There are tunnels that connect the House buildings underground. You'll go to the basement level and then there are tunnels. And there's also tunnels that connect the Senate building. So you'll go to the basement and go underground. Um, you can absolutely take a cab if need be between the Senate and House side for meetings, especially if you don't have a lot of time between your meetings. If you, let's say, like you have half an hour between a House meeting and a Senate meeting, book a cab or like Uber, just go for it. It's all good. If you are feeling, really drained from the day and you're like, look, this map says it's going to take me 15 minutes from Russell to Cannon. I know it's going to take me double that because I'm a little tired. It's towards the end of the day. You can absolutely grab a cab. And the other thing is just to be mindful of is that so there's security to get into the building in any of these buildings. But once you get in, let's say you go into Russell, which is on the north end, and then you start taking the tunnels to get to Dirksen or Hart, there's no security. So it's just one time you go through security. Then when you exit and you try to go to the House side, you'll have to go through security again. It's kind of like airport security, but you don't have to take your shoes off unless your shoes have metal, like my heels tend to. Um, and then you walk in, and then as soon as you go underground, you don't have to go through security again to go to Longworth or Rayburn if you just enter through Cannon or any of the other buildings. So that's just something to be aware of. Is it's not weird that you're gonna go through a metal security gate or anything like that. That is just protocol. Next slide. So how is your meeting going to work? You and a buddy or a couple buddies are going to arrive. Ideally, you're going to arrive 5 minutes before your meeting, and you're just going to wait outside. And then once you're 2 minutes before your meeting, you can enter in and let the staff assistant who's at the front desk know that, hey, I'm here and I'm here to meet with so and so, and we're volunteers of the American Lung Association. Have your business cards out and ready. So that's the thing you give to the staff assistant usually, and then they go back and get the person and they give that person your business card. Then you're going to conduct your meeting per the plan that you and your partners have created, which next week there will be time for you and your buddies to connect and to create your plan. If the member is at the meeting or comes by towards the end or at the beginning, try to get a picture with them. Just ask them nicely, or you can always ask the staff person at the end of the meeting, hey, is there a chance that the member is going to come by later? Any chance we could maybe come by and grab a quick pic? And then when the meeting is done, we ask that you please send a follow-up email to staff and CC, and ideally you just need one person from your group to send that email. And then CC the other participants as well, just thanking them for taking the time to meet with you, reiterating the 3 asks, and then also following up if there's any sort of follow-up that they've asked and you've kind of looked it up and you know the answer now, or you can even say, Lung Associate, I know you asked about XYZ, and Lung Association staff will follow up with you in the next couple of days. If you have social media, you can send out a friendly tweet tagging the office, specifically their government Twitter or X or whatever, or Threads, whatever it's called now. And there's a way to tell that usually when it's a congressperson and they have Twitter, when you go on their Twitter and you look up the website that's associated with it, if it's a .gov, then you know it's official. And if it's a .com, that's their campaign. So we just ask that you try to keep it official. And if you have any questions or you're like, I don't know, you can ask us and we'll help you out with that. And then if there's any sort of very immediate follow-up, just email myself. I'm ranjana.cable@lung.org and erica@erica.sword@lung.org to know that, hey, I put this in the Soapbox mobile tool, but you know, like you should do this kind of ASAP, and we'll get on it. And then check your schedule, the one that Soapbox sent you and the one that you're going to have access to on the mobile tool that they'll discuss next week to confirm that your next meeting is when you still think it is. Um, there's always a chance that a meeting can get moved last minute because sometimes a vote comes up and you're kind of coming at a slightly chaotic time. That was not intentional. We had hoped the government would have their act together, but not necessarily the case this time. Next slide. So who's in your meetings? You are going to be in your meetings, of course, and a caregiver if that's applicable, and then another RAD participant. So for some of you, it's going to be one COPD advisory group member and an asthma advisory group member. You might have two COPD advisory group members. You might have two asthma advisory group members. We did our best to try to make sure there was at least one COPD and one asthma advisory group member, but sometimes it didn't necessarily work out because we also had to be mindful of your state and who you were meeting with and how we wanted to partner you up that way. There's also a chance that for some of these congressional meetings, either I or Erica will just pop by. There are going to be a few meetings that we just we sit in. We're not going to talk. We're not going to, you know, take over, or we're going to let y'all run your meeting the way y'all planned it. We're just there maybe towards the end of the meeting to maybe give a little bit more information or to have a little bit of another discussion, but we will not be interfering at all with your meetings. But please don't be surprised if you happen to see us pop by. There will also be a Lung Association staff member who will be in the meeting if you require assistance with a wheelchair. We have 5 volunteers from our DC office, including Lauren and Rebecca, who will be pushing some wheelchairs. And so if that's the case, they will also just sit in the meetings as well. And then, of course, you're going to have either a senator, representative, or most likely their staff be in the meeting. Just so I know y'all are more experienced advocates, and I'm sure you know this, but I just want to reiterate that staff are powerful. They're the gatekeepers to the members. They might look young, and it's probably because they are young, but I promise you they're the people that kind of whisper in the leader's ears or in the chief of staff's ears, and they're usually the policy wonks, so they're the people you really want to talk to, right? Because they're the ones who are kind of working in this day in and day out. Next slide. Great. As a reminder, please do not video or audio record your meetings. People clam up if they're being recorded, and we want the folks that you're meeting with to be relaxed and to feel comfortable when they're speaking with you. Usually they can be a little more candid, but the second they know they're being recorded, they're not going to want to say anything. Also, it's not cool to record people without their permission, and we're not going to even ask. We're just not going to do it. Next slide. So some meeting tips. Next slide. So during the training next week on Wednesday, there will be time for role plays. We're going to give you some scenarios that you can use. You can also maybe come up with your own scenarios based on who you're meeting with and if you know their politics or their policy really well. So that's going to be a really great opportunity for y'all to figure out your game plan since you're going to be partnered up with people. So do what works for you and your team. Figure out, who's going to go first, who's going to talk about oxygen, who's going to talk about asthma, who's going to come together and tie it in together with CDC and NIH. So just do what works for your team. Have that plan for how the meeting will unfold and stick to the plan. Sounds easy. And usually these meetings are fine. All good. Next slide. So just as a quick example, we kind of started this already. You enter in 3 minutes before your meeting set to start, get your business card out and introduce yourself to the staff assistant who's at the front. Say, I'm so-and-so, I'm here to have a meeting with so-and-so, and we're from the Lung Association. They might offer you drinks or snacks, and if you want them, you can take them. If they're not offering it to you, you can still ask. They always have water bottles. They'll always have coffee. All of that is there. Some of you might get lucky and meet with a member that has cool snacks, like a New York member has Tate's cookies. I'm always a fan when I go into that office because they're delicious. Anticipate some small talk. They might ask you, how's your flight? Where are you from? Where'd you go to high school? If you're from St. Louis, Missouri, you get that question a lot, which is where I'm from. And then you're going to want to thank your member or the staff for joining, for taking the time to meet with you, and then share that 2 to 3 minute version of your story. And then you want to let the other person talk, and then you make your asks, or you tie them into your story, whatever y'all decide to do. Always allow the staff to respond, and try to get some dialogue going. Don't let people skate around the question. You can ask them, hey, like, don't skate. And then get a picture with the member if possible, or you can always ask, hey, can I come back later and get that photo? And then close up with saying that you're going to follow up and thank them for their time. If staff asks you a question and you're like, I do not know the answer, that is totally okay. It's okay to not know the answer. I don't know the answer. Like 20% of the time or 30% of the time I go in these meetings, I'm underestimating my own not knowing the answer probably. But it's a great way to follow up, and it's a great way to keep in touch. So it's totally fine to say, that's a great question. Do you mind if I follow up later? Next slide. Okay, so I am done talking, and I'm going to let Lauren take it from here.
Thank you, Ranjana. Okay, so like we mentioned earlier, we want you guys to be taking pictures. You might get the opportunity to take a picture with your member or the staff member. Sometimes staff members don't want their pictures taken. I will advise you to politely ask, but if they decline, that is what it is. We also want you to take pictures of the Capitol building or take a selfie. I'm going to move on to the next slide here. Take a selfie in the hallways. It's really cool to walk around. I know that some staff or some representatives have post-it notes or, fun activities to do outside their office. Or if you like a particular representative or senator, you can take a picture right next to their plaque. We want all of those pictures. And the way we're going to collect all those pictures, by the way, no pictures of the interior of your meetings or recordings of any kind, but we want you guys to be uploading them to our lovely Google Photos drive. We shared the link here. We'll also share the link when we follow up with this call. And everybody can add to this album without having a Gmail. You just need to have the link. You can just tap the Add Photos blue button, click on the cloud icon, select from your photo library, and add any photos you want of your Capitol Hill visits. We want to know who's in the photo too, if you can. Sometimes we don't know the representatives' faces just by looking at them. We know all of your lovely faces, but let us know in the comments. There's usually a little comment button right next to the photo you uploaded, just so we can know who you had the pleasure of meeting with. If this doesn't work for you, no problem. You can just email me or Annette to be added to the photo album, and I'm sure we will be circulating them when we wrap up at the end of the day. We wanted to get a good feel of the Wednesday morning checklist. We kind of shared the schedule with you already. The buses are going to be leaving in the morning. You guys got to get ready, but your breakfast is going to start at 7 a.m. We'll probably be eating until about 8 a.m. We're going to be passing out personal folders and leave behind folders, so you can leave them behind at the meetings you go to. So please make sure you have those. Those are very important. They have all the information you need for your meetings, all the background information, all the information that staffers or members might need. And then check your meeting schedule with Soapbox again. You're going to have that mobile tool like we talked about. Again, our Soapbox people will be telling you how to use that, where to find it, and everything when we go to our training. So just hold tight on that. I know that Soapbox just emailed all of you guys with your schedules. Very exciting. I've been watching your schedules get all hammered out. So take a look at that, just a preliminary idea of what's going to be going on. After you're done with breakfast, hopefully around 8 a.m., begin to board the bus at 8:20. They're going to be leaving at 8:30. If you want to board even sooner than then, I'm not sure if they're going to be opening up the doors earlier than that, but make sure you're on that bus because we're leaving. We won't leave you behind, but please do try to be on time. And a couple other reminders. Remember to silence your phones when you're in a meeting. Phone calls can be distracting, and we want to make sure that we're focusing on our asks. Try to stay on topic. We want to really hammer in on our shared messaging so we can get as far as we can with all of these asks. They're very important. We really want to let the staffers and members know that these subjects need to be addressed. Meetings are typically 15 to 20 minutes. So be clear, be succinct with your stories and statements as much as possible. Don't try to monopolize the conversation. Like Ranjana said, we want this to be a dialogue after you've shared your asks and your story. Like I mentioned, fact sheets will be left behind with a folder after the meeting. Those will be in your white folders. Again, we'll remind you of that in our training. And do not debrief in a public space unless you're the only ones around. This is so important. The walls have ears. If you are inside one of those buildings, you have no idea who could be listening to your conversation. Go outside, go to a private place. Most importantly, we just saw a story the other week about a conversation that was overheard on a flight that became national news about an insurance company. So debrief in a public space. There will be plenty of time to talk about your meetings in our reception afterwards as well. Couple other reminders. I'm sure all of your stories and photos are on lung.org, and that has been working with you guys on that. So just make sure that's a thing. If it's not, let us know. Definitely keep practicing your story and connecting them with the asks. We just shared your groupings with other people in your meetings. So start to connect with those people. You'll also be able to connect with the people in your group Tuesday evening at the dinner and Wednesday morning at breakfast and the training. And finally, do you need business cards? I have everybody's who requested business cards already printed out. But if you think you might need a business card, let me know. Just email lauren.buckley@lung.org. Or if you can't remember my email, just anybody, it'll get forwarded to me eventually, and then I'll print out your business cards and we will hand them to you at our training. All right, passing it back over to Ranjana for reimbursements. Very fun.
Yes, I get the fun task of talking with y'all about finances and reimbursements. So on Tuesday, I suspect many of you, or if not all of you, will be leaving. So any travel from the airport, cabs, Ubers, from the airport to back to the airport, from your home to your home, at the front end and the back end of your trip will be reimbursed. If you are leaving early in the morning, of course, breakfast and lunch will be compensated. So, your compensation of your meals kind of begins at the time when you leave. So if you aren't leaving until 2 p.m., yes, we'll probably compensate your lunch, but we will not be compensating your breakfast because you will be at home still. So as a reminder, for breakfast, there's a $25 per diem. For lunch, there's $25. And then for dinner on Tuesday, you will have the patient advisory group dinner. So that will be provided for you. So there's no need to go purchase any food for dinner. On Wednesday, all of your meals will be provided to you. We got you breakfast, lunch, and dinner. On Thursday, breakfast will be provided from 7 to 8 a.m. and it will have protein and will have more than hard-boiled eggs and we will have a variety. I've been promised this. And then for lunch, you are going to have $25 to spend. And that is where you're probably going to go somewhere on in the House or in the Senate to grab lunch. We will actually have a one-pager for you all in your participant packet sharing where you could try to grab lunch on the Capitol complex. And then dinner that evening will be provided. There's the ACRC dinner. And so Annette, I know, has probably shared, or Lauren has shared information about that. Friday is departures and cabs will be reimbursed, of course, as well. As a reminder, food and cabs, you are only allowed to tip 20%. That is a lung association policy. That is the maximum that you are allowed to tip. You will not be reimbursed for meals that we provide. So that is unfortunately the rules. So Tuesday dinner, Wednesday all day, we're going to be providing you with meals, so you will not be reimbursed if you go off on your own and buy your own food. The hotel does offer complimentary use of the BWI Airport and the BWI Amtrak Station shuttle service. So we will email you the number, or that you can call the hotel at a certain number to notify them of your arrival, and the shuttle driver will meet you curbside. If it's a really long wait or anything, just take the cab, take the Uber. It's okay. You will email your reimbursements to Annette. So please, please, please take pictures of all of the receipts. Luckily, it's not a lot of receipts, but please retain the physical receipts that are itemized and then take pictures of everything. As a heads up, for breakfast, let's say you are an early bird traveler on Tuesday. This is a weird thing we've learned from finance. If you're like, I only drink coffee and that or tea and that's my breakfast, that will not be reimbursed. You have to buy coffee or tea and then purchase like a croissant, and then our finance department will be like, yes, that's breakfast, get reimbursed. It's a very weird rule, but it is a rule. So I just want you all to be mindful of that. The other thing is for dinners, alcohol is not covered. We do not pay for alcohol. So if you would like to purchase alcohol, absolutely go for it, but we will not reimburse you for it. The other thing is snacks. Like let's say you're on the hill and you're like, well, I don't want lunch, or I already had lunch, but I'm kind of hungry. Absolutely go ahead, buy a snack. It is just unfortunately snackage is not reimbursable. Um, and once again, please, please, please keep itemized receipts. Next slide. Okay. So the reason we need an itemized receipt is because that's what our finance department says we need. And sometimes if you're in a group setting and, like it's you and a buddy for RAD and one of you puts down your card to pay for lunch, you need the itemized receipt so that just so they understand, oh, like this lunch was for Jean and this lunch was for Mary. Like that way they just understand that you kept under your $25 per diem, they kept under their $25. Like that's just kind of it. For cabs, Ubers, and Lyfts, the receipt will need to show the date and ideally the trip detail, but usually as long as it has the date, like it's fine. Once again, meals, cabs, Ubers, Lyft, 20% tip. That is the maximum we're allowed to do. And then alcohol and snacks are not reimbursable. Next slide. Okay, so this is all of the upcoming dates. This is looks complicated, but it's everything we already talked about, I promise. So September 19th, throughout that day, you're going to be arriving. That's Tuesday. So you're arriving the daytime, the evening time. I'm not really sure, but definitely keep track of your flight status. And then at 6 p.m., there's the patient advisory group dinner at the BWI Weston. Then on September 20th, that's the Wednesday, you have training. For 8 o'clock is when breakfast starts, and training starts at 9:30, I believe, till 5 p.m. That also includes the roundtable. As a heads up, the roundtable that we discussed, the 3:30 to 5 p.m. roundtable, that will include people from our sponsors that are going to be attending. They have submitted some questions. We have our own questions. So there are some guardrails around what we will be discussing, but just so you are aware that it's not just amongst y'all or us, that our sponsors will be there as well, and that the reception that takes place at 5:30 will include them as well. Dinner, though, is just going to be this cute group right here, plus the few people that weren't able to join our call today, like Annette and Erica. And then on Thursday, that is RAD Day. Also Earth, Fire, Wind Day, because it's September 21st and there's the song, Do You Remember the 21st Night of September? So I like that. But 7 a.m., once again, breakfast will be provided. And then at 8:30 is when we're going to be departing to DC. And then 9:30 to 5 p.m. at any point during that time frame, you're going to have your meetings on Capitol Hill. 3:30 p.m. if you're free and you're like, I don't have any meetings, it's 3:30 p.m. I'm tired. Once again, this is going to be in your participant packet, but you are more than welcome to go to the conference rooms of Health, Medicine, and Council. They're going to be very close to the Senate side, but you can rest there, absolutely, if you want to kind of get away. 6 p.m. is when you'll have your ACRC dinner at the BWI Weston. So a bus will take y'all at 5 p.m. and take you to Baltimore. And then on the 22nd, so that Friday at 8 a.m., you're going to have your ACRC steering committee breakfast and a patient advisory group update to the committee. If you have particular questions about this day, either Lauren or Annette are going to be your best people to answer questions because I am a little in the dark on your Friday, but that is what's happening. And then later throughout that day, you will be leaving and flying back home, which is kind of a bummer, but I'll be really excited that we got to spend 2 days together. Next slide. Questions and answer time. So I think we can take the slides off and then if any of y'all have questions, you're more than welcome to raise your hand or get off mute or type it into the chat and we'll do our best to answer your questions. It's Valerie.
So do you cover airfare, cab fare to get from our house to the airport and back to our house, even
Yep.
if it's a little outside the window of the official, because I'm getting in early and coming home late?
Yes, we cover that because there's no reason you would have been going to the airport if it wasn't coming to the ACRC
To
thing,
see
you know,
all
so
our wonderful new friends, yes.
yeah. So all of that will be covered.
Oh, my family will be very delighted. Thank you.
Yeah. Yes, Mary.
Did I hear correctly with Senator Cassidy?
Yes.
That-
I'm
Yes,
sorry.
you
This is
did.
the first you guys
well,
are
I know I
hearing of
heard that.
this.
I know I heard that correctly, and I'm so excited. But so did I hear that you're looking for like a Democratic? And
Yes.
can that be anybody, or are you looking for a particular committee still?
We're still
There-
looking for particular committees.
Yeah. So there's a
Okay.
short list of people that are on, you know, that the group is considering, that Erica is targeting, and that now we're going to be working with Cassidy also to identify, because that now that there's somebody, they have a say a little bit too, and who gets to sponsor with them. So that's still in the works.
Okay,
So you'll
but
let
now
us know. Whoops. Go
well, I
ahead.
was just going to say, but now that when we're in the meetings and we mention this and they say, you know, is there a sponsor? We can at least say, yes.
Senator Cassidy has agreed to sponsor. Yeah.
Okay.
And
Awesome.
yeah, and you can say, like, you know, we know it's a bipartisan issue, and that we are working to find a Democratic co-sponsor, because people like it when a bill is bipart.
Yeah.
Valerie.
So you'll let us know if any of our senators are amongst the targets in the small group, because I know our senators are very pro all health things in Hawaii, but we're very minorities, so I'm not sure that we are the targets.
We will let you know.
We will let you know, and odds are is that if one of y'all have a member that is is on that little short list, Erica will probably join that meeting for that reason then towards the end, to kind of bolster the message that you all were pushing. So we're strategic about what meetings we might pop into for that reason.
Thank you. Jean? You're muted.
I'm sorry, remind me where Cassidy's from.
Louisiana.
Okay, thanks.
Yes, I just wanted to note that this is very new news, and this is the first we are telling anyone. So Mary and Jean, we're going to let the rest of the group know after this call. But yeah, we are so excited. And I don't want to jinx it, but like usually this means that most of the like hardest part of getting a bill introduced is done. Like the hardest part is just getting that first step taken. So
Yeah.
We're optimistic.
Yeah, make sure that Erica and Gary are congratulated heartily.
Yes, we have done so.
Because they've really worked to get this taken care of.
I think Erica said that she was out on a walk with her husband when the staff person called her back, and so she was like, "Oh, I wonder what this is," and took the call and like screamed, just you know.
I bet she did.
I assume not like when the staffer was on the call, but afterwards to her husband, because it's so exciting.
Would it be inappropriate to like drop off a thank you note to Cassidy?
I think at this point we're going to wait, because we want to wait until things get even more official before we
Sure.
send anything. Yeah, but
Okay.
I think afterwards, once it's a little more official, a thank you email or anything like that is totally fair game, and they will let Erica or Lauren will let you know.
All right. Yeah, I'm just so excited, but I certainly don't want to jump, you know,
The gun a little bit. Yeah, I get it. Yes, Valerie.
Just wanted to give a warning that sometimes if you're going to go in the tunnels, they will confiscate food. I have brought macadamia nuts that has been confiscated by the security people. I was going to give them to members, so I was very unhappy. So just a word to the wise, if you are going to go in tunnels, be aware.
Yeah. Usually if you can hide it in a little bag, they don't check then, usually. But
They were thorough.
oh, they were for you. Okay. When were you there last?
I can't remember when they stole it, but we were shocked because we had brought them through tunnels prior times,
Yeah.
and we had an aide with us, and they still were whatever. We weren't gonna fight.
That's a good warning though.
Question. So I was going to bring kind of a rolling bag with me. Just it's hard to carry things, and is that all right?
It should be, but let me double check. If you I can email you after so I understand a little bit more about the specifics of the kind of bag that you would like to bring, and I'll just compare it to the House Senate rules. But I don't see it being an issue.
Okay.
Especially
Yeah. I mean, I was thinking like a rolling backpack that I could put the folders in, and
yeah,
like my purse, just carrying the oxygen, carrying the purse, carrying multiple things. Just
is a lot. Yeah.
Yeah.
So let me look into that, but just to double confirm.
Okay. All right. Thank you.
It'll probably only be a problem with security. And then it'll be they'll have to take it apart.
Yeah. I mean, I figure they'll search it all, right? But
yeah, they usually do.
Any other questions? Pop them in the chat, raise your hands, unmute. Well, we're really excited to see you. This is going to be a very fun event, even though we wake up pretty early most days, but it's all right. Yeah, no, if you guys have any additional questions, you think of them later, or just want something clarified, feel free to email any one of us. We will get back to you as best we can. But other than that, things are chugging along, and we're very happy with the updates to our asks. Hopefully you guys are too. But yeah, thank you all for joining so much. I hope you have a wonderful rest of your day. Have a safe flight out to DC, or a safe drive or walk, or however you're getting here.